Welcome to Pediatric Case Review. Today, we will be discussing Ataxia Telangiectasia in children, providing a comprehensive overview for general pediatricians. Our goal is to help you recognize the early signs, understand the diagnostic process, and implement appropriate management strategies for these patients. A 3-year-old child presents with progressive, unsteady gait. Which of the following best describes Ataxia Telangiectasia? A. X-linked dominant neurodegenerative disorder affecting 1 in 50,000 births. B. Autosomal recessive neurodegenerative disorder affecting 1 in 40,000 to 1 in 100,000 births. C. Autosomal dominant cerebellar disorder affecting 1 in 10,000 births. D. Mitochondrial disorder affecting 1 in 25,000 births. The correct answer is B. Ataxia telangiectasia is an autosomal recessive neurodegenerative disorder affecting approximately 1 in 40,000 to 1 in 100,000 births worldwide. It is a multi-system disorder that primarily affects the nervous and immune systems, with progressive cerebellar ataxia as a hallmark feature. It is sometimes referred to as Lewis-Barr syndrome. Which gene mutation is responsible for Ataxia telangiectasia? A. SMN1 gene on chromosome 5. B. ATM gene on chromosome 11. C. MECP2 gene on X chromosome. D. Dystrophin gene on X chromosome. The correct answer is B. Ataxia telangiectasia is caused by mutations in the ATM gene, which stands for Ataxia telangiectasia mutated, located on chromosome 11. This gene provides instructions for making a protein that helps control cell division and is involved in DNA repair. When the ATM gene is mutated, cells cannot properly respond to DNA damage, leading to genomic instability. Which cellular process is primarily impaired in Ataxia telangiectasia? A. Glucose metabolism. B. Protein synthesis. C. DNA damage repair. D. Neurotransmitter release. The correct answer is C. In Ataxia telangiectasia, DNA damage repair is the primary cellular process impaired. The ATM protein normally functions as a sensor of double-strand DNA breaks and activates cellular responses to repair this damage. When this function is lost, cells accumulate DNA damage leading to genomic instability, which explains the increased cancer risk, neurodegeneration, and immunodeficiency seen in these patients. A 2-year-old boy has recently started walking, but his parents note he falls frequently. What is typically the earliest clinical manifestation of Ataxia telangiectasia? A. Ocular telangiectasia. B. Progressive cerebellar ataxia. C. Recurrent sinopulmonary infections. D. Cutaneous telangiectasia. The correct answer is B. Progressive cerebellar ataxia is typically the earliest clinical manifestation of Ataxia telangiectasia, usually becoming apparent when the child begins to walk, between 1 and 4 years of age. Parents often notice excessive falling, poor balance, and unsteady gait. This may initially be dismissed as normal childhood clumsiness, potentially delaying diagnosis. The ataxia progressively worsens over time. A 5-year-old with progressive ataxia shows eye abnormalities during examination. What is typically seen in the eyes of patients with Ataxia telangiectasia? A. Retinal hemorrhages. B. Oculomotor apraxia and conjunctival telangiectasias. C. Cherry red spot on macula. D. Optic atrophy. The correct answer is B. Oculomotor apraxia and conjunctival telangiectasias are characteristic ocular findings in Ataxia telangiectasia. Oculomotor apraxia manifests as difficulty initiating voluntary eye movements, where children often turn their head first before moving their eyes. The telangiectasias, which are dilated blood vessels, typically appear on the conjunctivae between ages 4 and 6 years and are a defining feature of the condition. A 7-year-old with known Ataxia telangiectasia is examined. Which neurological finding would you not expect in this patient? A. Dysarthria. B. Intention tremor. C. Hyperreflexia. D. Chorioathetoid movements. The correct answer is C. Hyperreflexia would not be expected in Ataxia telangiectasia. Instead, these patients typically have diminished or absent deep tendon reflexes due to the peripheral neuropathy component of the disease. They commonly demonstrate dysarthria, slurred speech, intention tremor, and chorioathetoid movements, all of which reflect progressive cerebellar and extrapyramidal dysfunction. A 4-year-old with Ataxia telangiectasia has had 3 pneumonias in the past year. Which immunological abnormality is most common in Ataxia telangiectasia? A. Neutrophil dysfunction. B. IgA deficiency and variable IgG deficiency. C. Complement pathway defects. D. Natural killer cell deficiency. The correct answer is B. IgA deficiency and variable IgG deficiency are the most common immunological abnormalities in ataxia telangiectasia. Approximately 60 to 80% of patients have some form of humoral immunodeficiency. This explains their increased susceptibility to sinopulmonary infections. Additionally, many patients also have abnormalities in T cell numbers and function, resulting in a combined immunodeficiency pattern in some cases. A 3-year-old with progressive ataxia and recurrent infections is being evaluated. Which laboratory finding is most specific for ataxia telangiectasia? A. Elevated alpha-fetoprotein levels. B. Elevated creatine kinase. C. Low vitamin E levels. D. Elevated ammonia levels. The correct answer is A. Elevated alpha-fetoprotein levels are the most specific laboratory finding for ataxia telangiectasia, present in more than 95% of patients. AFP levels are typically 10 to 100 times the normal range. This is a relatively simple blood test that should prompt consideration of ataxia telangiectasia in any child with unexplained progressive ataxia, even before the appearance of telangiectasias. A 6-year-old girl with suspected ataxia telangiectasia needs confirmation. What is the gold standard for confirming ataxia telangiectasia diagnosis? A. Brain MRI showing cerebellar atrophy. B. Genetic testing for ATM mutations. C. Immunoglobulin level assessment. D. Skin biopsy showing telangiectasias. The correct answer is B. Genetic testing for ATM mutations is the gold standard for confirming the diagnosis of ataxia telangiectasia. More than 600 different mutations in the ATM gene have been identified. While elevated alpha-fetoprotein and cerebellar atrophy on MRI are supportive findings, only genetic testing can provide definitive diagnosis. Functional testing demonstrating reduced or absent ATM protein activity in cultured cells can also be used for confirmation. A 5-year-old with ataxia telangiectasia undergoes brain MRI. Which finding is most characteristic of ataxia telangiectasia on brain imaging? A. Periventricular white matter lesions. B. Cerebellar atrophy, particularly of the vermis. C. Basal ganglia calcifications. D. Hydrocephalus. The correct answer is B. Cerebellar atrophy, particularly of the vermis, is the most characteristic radiological finding in ataxia telangiectasia. This atrophy is progressive and correlates with the clinical deterioration in motor function. It's important to note that patients with ataxia telangiectasia have increased sensitivity to ionizing radiation, so radiological studies should be limited to those absolutely necessary, and MRI is preferred over CT scans. A newly diagnosed 4-year-old with ataxia telangiectasia is seen for treatment planning. Which statement is correct regarding ataxia telangiectasia management? A. Gene therapy offers curative potential. B. Treatment is primarily symptomatic and supportive. C. Steroid therapy slows neurological progression. D. Bone marrow transplantation is standard of care. The correct answer is B. Treatment for ataxia telangiectasia is primarily symptomatic and supportive. Currently, there is no cure or disease-modifying treatment available. Management requires a coordinated multidisciplinary approach involving neurologists, immunologists, pulmonologists, physical therapists, and other specialists to address the various manifestations of the disease and maximize quality of life. An 8-year-old with ataxia telangiectasia has worsening ataxia and difficulty with daily activities. Which intervention is most appropriate for managing the neurological symptoms in this patient? A. Anticholinergic medications. B. Physical therapy and adaptive equipment. C. Deep brain stimulation. D. High-dose vitamin E supplementation. The correct answer is B. Physical therapy and adaptive equipment are the most appropriate interventions for managing neurological symptoms in ataxia telangiectasia. Regular physical therapy helps maintain function, prevent contractures, and improve quality of life. As the disease progresses, patients benefit from adaptive equipment such as wheelchairs, specialized eating utensils, and communication devices. These interventions focus on maximizing independence and functionality. A 6-year-old with ataxia telangiectasia has recurrent sinopulmonary infections and low IgG levels. What is the most appropriate management for the immunodeficiency in this patient? A. Prophylactic antibiotics only. B. Immunoglobulin replacement therapy. C. Systemic corticosteroids. D. Bone marrow transplantation. The correct answer is B. Immunoglobulin replacement therapy is the most appropriate management for patients with ataxia telangiectasia who have antibody deficiency and recurrent infections. This can be administered intravenously or subcutaneously on a regular schedule and helps replace the missing antibodies. Prophylactic antibiotics may also be used as an adjunctive therapy. Early aggressive management of infections is essential in these patients. A 10-year-old with ataxia telangiectasia requires cancer surveillance. Which malignancy has the highest risk in pediatric ataxia telangiectasia patients? A. Brain tumors. B. Leukemia and lymphoma. C. Osteosarcoma. D. Wilms tumor. The correct answer is B. Leukemia and lymphoma represent the highest cancer risk in pediatric ataxia telangiectasia patients. Children with ataxia telangiectasia have approximately a 25% lifetime risk of developing malignancy, with lymphoid malignancies being most common in childhood. Regular surveillance should include complete blood counts and careful examination for lymphadenopathy. The cancer risk is related to the genomic instability caused by defective DNA repair. A 12-year-old with ataxia telangiectasia has progressive breathing difficulties. What is the most common cause of mortality in ataxia telangiectasia patients? A. Malignancy. B. Respiratory failure. C. Cardiac complications. D. Neurological deterioration. The correct answer is B. Respiratory failure is the most common cause of mortality in ataxia telangiectasia patients. This results from a combination of recurrent respiratory infections due to immunodeficiency, aspiration due to swallowing difficulties, and restrictive lung disease from neuromuscular weakness. Preventive measures include aggressive immunization, pulmonary therapy, careful positioning during feeding, and swallowing evaluation to minimize aspiration risk. Parents of a newly diagnosed 3-year-old with ataxia telangiectasia ask about life expectancy. What is the most accurate information regarding prognosis in ataxia telangiectasia? A. Most patients survive into their 50s with supportive care. B. Life expectancy is typically into the 20s to 30s. C. Most patients do not survive past adolescence. D. Life expectancy is normal with proper treatment. The correct answer is B. Life expectancy for individuals with ataxia telangiectasia is typically into the 20s to 30s, although this varies considerably based on severity and complications. Improved management of infections and respiratory complications has extended lifespan in recent decades. When counseling families, it's important to balance honest prognostic information with emphasis on quality of life and the significant variability in disease course. The parents of a child with ataxia telangiectasia ask about genetic counseling. What information is correct regarding the genetic implications for family members? A. Siblings have a 25% chance of having ataxia telangiectasia. B. Only maternal relatives need screening. C. Future children have a 50% chance of having ataxia telangiectasia. D. Carrier testing is not available for family members. The correct answer is A. Siblings of a child with ataxia telangiectasia have a 25% chance of also having the condition. This follows the autosomal recessive inheritance pattern, where both parents are carriers, heterozygotes. Each pregnancy has a 1 in 4 chance of producing an affected child. Carrier testing is available for family members, and genetic counseling should be offered to discuss reproductive options and screening for extended family. Thank you for joining Pediatric Case Review for this comprehensive overview of ataxia telangiectasia in children. Remember that early recognition of this condition allows for appropriate support and monitoring. A multidisciplinary approach is essential for managing the diverse manifestations of this condition. If you found this information helpful, please follow our channel for more informative presentations on pediatric conditions. If you have any questions, please leave them in the comments section below.